everyone, my name is Raniah Imran, and today I'll be discussing tuberculosis and exploring how increased awareness and improved infrastructure can effectively combat this global health challenge. But before we dive in, let me tell you a little bit about myself. I'm a rising senior at the Academy of Information Technology and Engineering located in Stamford, Connecticut. I'm the president of the Science National Honor Society, as well as the co-president and founder of the Muslim Student Association. I am also the head of the organization and volunteer committee at my local mosque. I'm a part of varsity tennis, Red Cross, Model UN, Mathletes, National Honor Society, Spanish National Honor Society, Math National Honor Society, and RSpace. I am also interested in pursuing a career in emergency medicine. So to start, what exactly is tuberculosis? Well, tuberculosis is a bacterial infection caused by the Mycobacterium tuberculosis. This pathogen is transmitted through the air when an individual with active TB coughs, sneezes, or talks, releasing microscopic droplets containing the bacteria. When these droplets are inhaled, the bacteria can reach the lungs and begin to multiply. Symptoms of TB include a persistent cough lasting several weeks, chest pain, weight loss, fever, chills, fatigue, and in even severe cases, coughing up blood. Tuberculosis can present itself in two distinct forms, active and latent. When Mycobacterium tuberculosis bacteria enter the lungs, they are initially engulfed by alveolar macrophages, a type of immune cell responsible for destroying pathogens. In response to this invasion, the immune system forms granulomas, or clusters of immune cells that encase and isolate the bacteria to prevent its spread. This process leads to a latent TB infection, where the bacteria remain alive but dormant within the granulomas. In fact, 90 to 95% of TB infections are latent, with the bacteria remaining inactive and not causing any symptoms. However, if the immune system becomes compromised or weakened, the dormant bacteria can escape from the granulomas, multiply, and cause active TB. This progression results in tissue damage and the manifestation of symptomatic active TB infection. You may be wondering, how exactly is tuberculosis a global health issue? Well, according to the Global Health Report conducted by the World Health Organization, as of 2022, 10.6 million people worldwide have been infected with tuberculosis, with 55% being men, 33% being women, and 12% being children. Of those 10.6 million people, 1.6 million deaths have occurred. As you can see in this image, most high incidence areas appear to be in Nigeria, the Democratic Republic of the Congo, India, Indonesia, the Philippines, China, Pakistan, and Bangladesh. If we take a closer look at why mainly countries in Asia and Africa have higher prevalence of TB, we are able to find some similar characteristics. For instance, poverty is a significant driver of TB as it often leads to overcrowded living conditions that facilitate the spread of the disease. Additionally, impoverished populations frequently face limited access to healthcare services due to financial constraints or geographic barriers, which hinders timely diagnosis and effective treatment. Economic challenges further exacerbate the situation by contributing to underdeveloped medical infrastructure. Many healthcare facilities in these regions lack the essential resources and capabilities needed to provide adequate care. Consequently, there is a clear correlation between high poverty rates, inadequate medical infrastructure, and elevated TB incidences. These patterns underscore the disproportionate burden of TB in low and middle income countries and highlight persistent health disparities. Tuberculosis is recognized as a significant global health threat due to its high mortality rates and the growing challenge of drug resistance. The standard treatment regimen for TB typically involves a combination of antibiotics, including INH, rifampin, pyrazinamide, and ethambutol. However, the bacteria responsible for TB has a natural ability to develop genetic mutations that confer resistance to these antibiotics. Such mutations can alter the drug's target site within the bacteria and diminish its effectiveness. Resistance can also arise from other factors, such as non-adherence to the full course of treatment, incorrect dosages, or reliance on monotherapy rather than the recommended combination therapy. These issues allow some TB bacteria to survive and proliferate, leading to strains that are resistant to standard treatments. This poses a severe risk as resistant strains of TB can spread rapidly and become untreatable. The situation is further compounded in low and middle income countries where advanced medical infrastructure may be lacking. These regions often struggle to manage the high volume of TB cases, which can exacerbate the risk of broader epidemics. In response to the threat of drug-resistant TB, medical professionals have intensified efforts to improve treatment adherence and infection control. Many low and middle-income countries collaborate with international organizations to strengthen TB prevention and control measures. One effective strategy is the Directly Observed Treatment, or DOTS protocol, where healthcare workers observe patients taking medication in order to ensure that they are adhering to the proper course. Another program is the National TB Control Program, which tracks TB cases, screens high-risk areas, and diagnoses as well as treats patients with TB. The global fight against tuberculosis can be significantly bolstered through enhanced awareness and increased investment in medical infrastructure. Rising awareness about TB is crucial for early detection and effective prevention. Educating the public about the symptoms of TB can allow individuals to understand the disease as well as its consequences if not treated earlier, and encourage them to seek timely medical attention. Awareness efforts should extend to healthcare professionals as well, ensuring that they are well informed about the latest diagnostic methods and treatment protocols. This can enhance their ability to identify and manage TB cases more effectively, particularly in high-risk populations. Comprehensive educational initiatives can also promote adherence to treatment regimens, thereby reducing the risk of developing drug-resistant strains. Investing in medical infrastructure is equally critical in the fight against TB. Expanding and upgrading healthcare facilities is crucial for improving access to diagnosis and treatment, as well as ensuring that individuals living in impoverished regions also can access essential healthcare services. Funding should also focus on improving supply chains for essential TB medications, ensuring that treatments are available and accessible to everyone. Strengthening these healthcare systems in low and middle income countries can significantly enhance their ability to handle TB cases, reduce transmission rates, and ultimately prevent the escalation of TB into a more severe public health crisis. In conclusion, tuberculosis remains a formidable global health challenge, with its high prevalence concentrated in regions marked by poverty and inadequate healthcare infrastructures. The disease's impact is particularly severe in parts of Africa and Asia, where high poverty rates and overcrowded living conditions facilitate its spread. Addressing TB requires a multi-phase approach, including enhancing public awareness, improving medical infrastructure, and strengthening healthcare systems. Effective strategies such as the DOT strategy have demonstrated success in reducing TB incidence and mortality rates. However, the rise of drug-resistant strains underscores the need for continued vigilance and investment in both prevention and treatment. By expanding healthcare access and investing in education and infrastructure, we can better manage and ultimately reduce the burden of TB, leading to improved global health outcomes. These are my references. And I would like to thank you guys for listening to my presentation, as well as thank the Global Health Leaders Conference from the Johns Hopkins University for allowing me to present on tuberculosis. Here is my contact information for if you have any questions. Thank you.